Welcome to the Deep Dive, the show where we take a stack of sources, articles, and research and really distill them down into the most important nuggets of knowledge and insight for you.
That's the goal.
Today, we're embarking on a journey into a period of truly incredible, often unseen transformation, the very earliest weeks of pregnancy.
It's amazing stuff. While the outside might not show much yet, inside, well, a miniature marvel is rapidly taking shape.
Absolutely. And alongside that, for the expectant parent, there's often, that common roller coaster of emotions and physical changes kicking in.
Definitely roller coaster.
Our mission today is to take you on a captivating sort of chronological journey through weeks 2 to 13 of pregnancy.
Right from the start.
Yeah, we're going to unpack the comprehensive understanding of fetal development, guide you through the evolving physical and emotional landscape for the parent.
And share some really crucial, actionable advice gleaned from trusted sources, like BabyCenter, for instance.
Exactly. Consider this your clear, concise, and hopefully captivating shortcut to being truly well-informed about this foundational period. No need to wade through everything yourself.
Do the heavy lifting.
This deep dive is tailor-made for you, whether you're, intensely curious about the miracle of life.
Or maybe actively preparing for parenthood yourself.
Right. Or offering support to a loved one navigating their pregnancy journey.
Or maybe you're just seeking to gain profound knowledge quickly but thoroughly without getting totally overwhelmed by information overload.
Exactly. Get ready for some genuine aha moments and probably some surprising facts that will leave you absolutely fascinated by this whole intricate dance of life. Let's jump in.
Let's do it.
Okay, let's unpack this fascinating starting point. When we talk about week 2 of pregnancy, well, it sounds totally counterintuitive, doesn't it?
It really does.
But for most people, you're not even technically pregnant yet.
It's confusing, but yeah. Healthcare providers typically calculate a due date from the first day of your last menstrual period.
Right. So if you're on a pretty standard 28-day cycle, week 2 is roughly the time of ovulation.
Exactly. It's the biological starting line, you could say, for potential conception.
So it's a critical week, not for an established pregnancy, but really for the possibility of one beginning.
Precisely. The body's getting ready. And it's remarkable how it prepares. A crucial insight here is the precise timing of fertility.
Okay.
While conception hasn't happened yet in week 2, this is the week it's most likely to occur. You're actually most fertile during the 3 days leading up to ovulation and on the day of ovulation itself.
So there's a definite window.
A key window.
Yeah.
And the body often gives clear signals if you know what to look for.
Like what?
Well, you might notice a slight sustained increase in your basal body temperature. You track that with a special thermometer first thing in the morning.
Okay.
Some women also experience breast tenderness or mild cramps, a sensation sometimes called Mittelschmerz.
Mittelschmerz.
Yeah, right.
German for middle pain. Right. Makes sense.
Exactly. Aptly named for mid-cycle discomfort. And a very clear, observable sign is a change in cervical mucus.
Yeah.
It becomes clear, slippery, and stretchy, much like raw egg whites. This specific consistency is actually designed to help sperm on their incredible journey towards the egg.
Wow. So the body is literally paving the way. While it's signaling readiness externally, what's actually happening internally to prepare even before conception?
Well, internally, your uterine lining is busily thickening. This is prompted by a surge in estrogen and progesterone.
Getting the nursery ready, so to speak.
Kind of. It's creating this lush, nutrient-rich environment like preparing a cozy nest for a potential fertilized egg to implant.
Okay.
Simultaneously, within your ovaries, eggs are diligently ripening inside fluid-filled sacs called follicles.
Mm-hmm.
Once ovulation occurs, typically just one of these mature eggs will burst out from its follicle and get gently swept into a fallopian tube, just waiting for that potential encounter.
And that encounter, it's quite the biological race, isn't it? Can you paint a picture of what happens during that incredible moment of conception and fertilization?
It truly is an epic journey. During the 12 to 24 hours after ovulation, if healthy sperm successfully navigate their way from the vagina, through the cervix, up through the uterus, and into the fallopian tube to meet the egg, well, fertilization can happen.
The odds seem incredible.
They really are. Consider this.
Yeah.
Roughly 250 million sperm might be in an ejaculation, but only about 400 manage to survive that challenging 10-hour journey to reach the egg.
Just 400. Wow.
And typically, only one, the strongest and most resilient, actually succeeds in burrowing through the egg's protective outer membrane.
The winner.
The winner. Then, in the next 10 to 30 hours, that single successful sperm's nucleus merges with the egg's nucleus, combining their unique genetic material.
And that's the moment.
That's the moment. This is when the baby's sex is determined. If the sperm carries a Y chromosome, it's a boy. An X chromosome means a girl.
Fascinating.
And this newly formed, single-celled, fertilized egg is now called a zygote, the very beginning of a new human life.
That's just the very first step, though, isn't it? It's not implanted yet. What happens next as that zygote starts its journey?
Exactly. The zygote immediately begins this remarkable 3 to 4 day journey, traveling down from the fallopian tube towards the uterus.
Okay.
And along this path, it's constantly dividing, multiplying into 100 or more identical cells, but interestingly, without actually getting bigger overall yet.
Still microscopic.
Very much so. Once it enters the uterus, it's no longer called a zygote. It's now a blastocyst, basically a tiny ball of cells with a hollow center.
Blastocyst, got it.
Then maybe a day or two later, this blastocyst undergoes a crucial step called hatching. It actually sheds its clear outer shell.
Like a chick hatching.
A bit like that, yeah. This shedding allows it to then start burrowing into that lush, prepared lining of the uterus.
Implantation.
Exactly. That's where it will continue to grow and divide, establishing its connection. This burrowing process is implantation, and it's absolutely critical for a viable pregnancy.
That's a lot of microscopic action for what's technically week 2. Given how important this foundational period is, what should someone be thinking about for their checklist, even before they get a positive test? What's the practical advice?
Okay, a really critical piece of advice, often overlooked, is to start taking prenatal vitamins now, specifically one with at least 400 micrograms of folic acid daily.
Before you even know for sure.
Absolutely, because your baby's neural tube, which forms the brain and spinal cord, develops incredibly early, sometimes even before many people realize they're pregnant.
Wow, okay.
And folic acid is proven to help prevent serious birth defects in that system, like spina bifida. Plus, these vitamins provide other key nutrients like iron, vitamin D, calcium, just laying a healthy foundation.
Good advice. And beyond the daily vitamin, what about medical check-ins or bigger picture health things?
Well, this raises an important point about preconception checkups. It's actually highly beneficial to see your healthcare provider before you actively start trying to conceive, if possible.
A pregame checkup.
Sort of. This visit lets you proactively discuss any existing medications you're taking, prescription, over-the-counter, even herbs to make sure their pregnancy is safe, or to find alternatives if needed.
Good thinking.
It's also a great time to address any concerns you might have about pregnancy or parenthood and review your family medical history.
Right.
And your provider might also suggest genetic carrier screening. It's usually just a simple blood or saliva test.
What does that screen for?
It checks if you or your partner carry genes that could put your baby at risk for certain serious inherited illnesses, like cystic fibrosis or sickle cell anemia, even if these conditions are rare in your families.
Is that common?
Surprisingly, yes. Some studies show nearly a quarter of individuals tested were carriers for at least one genetic mutation. So it's a valuable step for getting informed.
Definitely good to know up front. Beyond medical prep, what practical advice can we offer for, optimizing the chances of conception and just general well-being during this hopeful time?
Well, the advice for optimizing conception itself is fairly straightforward. Frequent, well-timed sex.
Okay.
Studies suggest that couples who have sex daily or every other day during that fertile window, especially the 3 days leading up to and including ovulation, have the highest pregnancy rates.
So timing is key, but don't stress too much about it.
Exactly. You don't need to turn it into a chore, but being aware of that window helps. A good rule of thumb might be every 2 to 3 days soon after your period ends, because sperm can live for up to 72 hours inside you.
Wow. Okay. Waiting for the egg.
Right. And alongside this, prioritizing self-care is really paramount. Reducing stress levels through things like massage, gentle yoga, or deep breathing exercises. Well, there's evidence it can potentially increase your odds of conceiving and definitely contributes to a healthier pregnancy overall.
Managing stress seems crucial for so much. And it's not just about what you do, but also what you avoid, right? Creating the healthiest possible environment from the very start.
Absolutely. When you're actively trying to conceive, and especially in these very early foundational weeks, it's vital to steer clear of harmful substances.
Like what specifically?
Well, tobacco, marijuana, illegal drugs, and also excessive caffeine, and definitely alcohol.
Okay.
All of these can potentially negatively impact your ability to conceive, interfere with that delicate process of early fetal development, and affect overall pregnancy health.
Mm,
It's really about creating the healthiest possible environment for a new life to begin and flourish.
makes sense. Okay, so as we transition into week 3, this period is often called the 2-week wait.
Ah, yes, the TWW infamous.
Right. For anyone trying to conceive, this can be an incredibly anxious, drawn-out time between potential conception and finally getting that positive pregnancy test.
Patience is so hard, but so key here.
Yeah. It really is. Because home pregnancy tests are only reliably accurate on or sometimes after the first day of your missed period. Testing too early can easily lead to false negatives or those really ambiguous, frustrating faint lines.
Been there. You just want to know.
Exactly. So developmentally, what's happening inside during this week? Wait. It's still microscopic, right?
Oh, absolutely tiny, but incredibly complex things are happening. That blastocyst, the rapidly dividing ball of cells we talked about,
Yeah.
it's actively burrowing and embedding itself deeply into the lush lining of the uterus. That's implantation happening right there.
So it's really settling in.
It is. And as it does, the outer layer of these cells starts forming what will eventually become the placenta, that amazing life support system delivering oxygen and nutrients and removing waste.
Wow.
Meanwhile, the inner cells are destined to form the embryo itself. This period also sees the very beginnings of a primitive circulation system, starting to connect to the blood vessels in the uterine wall to get that vital exchange going.
And what about those early hormones? The ones that actually signal, yes, pregnancy has started.
What's fascinating here is how quickly the developing placenta starts churning out human chorionic gonadotropin, or HCG.
HCG, that's the one pregnancy tests look for.
That's the one. It's basically your body's pregnancy-confirmed alarm bell. And it also acts like a stop sign for your period.
How so?
Well, HCG sends this critical signal to your ovaries, essentially telling them, hold up, no more eggs needed for now, keep producing progesterone.
Ah, and progesterone keeps the uterine lining thick.
Exactly. It prevents the lining from shedding, maintaining that cozy environment for the developing baby. So it's this specific HCG hormone that every home pregnancy test detects in your urine, making it the definitive chemical marker of early pregnancy. Without it, the pregnancy couldn't continue.
So even though it's still incredibly early and the baby is microscopic, are there any subtle physical signs someone might start to notice in week 3? Anything hinting at those surging hormones?
Some women do, yes, but it's also incredibly common and totally normal to feel absolutely nothing different yet. That needs to be stressed.
Okay, good point. But if symptoms do appear,
They might be very subtle. Maybe some bloating or mild cramping. Sometimes people describe that as implantation cramping as the blastocyst burrows in.
right?
Or even some light spotting. This implantation bleeding, if it happens, is typically much lighter than a period, often just a few drops, maybe pinkish or brownish, and usually only lasts a day or two, maybe 3 at most.
Okay.
Other subtle signs could be breast tenderness starting, or maybe that heightened sense of smell kicking in.
The super sniffer effect.
Exactly. Suddenly your partner's cologne, or the garbage can, or even your beloved pet might smell incredibly strong or just different. If that happens, you can definitely thank those surging hormones.
Given this really delicate and crucial stage of establishment, what should be on the checklist for week 3? What should people be focusing on?
Well, beyond the physical, focusing on emotional well-being is incredibly important during this waiting period, which, let's be honest, can be super stressful.
Definitely.
Journaling can be a really powerful and healthy tool here. Just writing down your thoughts, your feelings, your anxieties, your hopes. It can really help you navigate that unique mix of anticipation and worry.
Good idea. What about physical safety?
Safety is paramount. And this brings up an important point about avoiding overheating. While a warm bath is generally fine, you should definitely steer clear of prolonged time in really hot environments like steam baths, hot tubs, and saunas.
Why is that?
Because a significantly elevated core body temperature, especially in these crucial early weeks, has been linked to an increased risk of neural tube defects in the baby.
Okay, noted. Hot tubs are out for now.
For now, it's also a good time to consciously think about and prioritize pregnancy-friendly foods. Focus on getting plenty of vitamin C, think strawberries, bell peppers, iron from sources like lean beef, lentils, spinach, and calcium-rich foods like yogurt, cheese, or fortified cereals.
Laying the nutritional groundwork.
Exactly. Foundational nutrients for both you and the baby's very initial development.
And continuing from last week, that focus on what to avoid is still critical, right?
Yes, absolutely. Reinforcing those healthy habits is key. It's recommended to limit caffeine intake. Think roughly 1 standard cup of coffee a day, staying under 200 milligrams.
Okay.
Because excessive caffeine has been linked to potential negative impacts on pregnancy. And really importantly, if you currently smoke, drink alcohol, or use recreational drugs, now is the most crucial time to seek help and support to quit.
It's a huge step, but maybe the most impactful one.
It really is for your baby's health. And lastly, thinking ahead, try to improve your sleep habits now. Pregnancy sleep problems like discomfort or peeing all the time can definitely hit later.
Get the good sleep while you can.
Pretty much. Establishing a regular bedtime routine and making your bedroom a peaceful sleep sanctuary now will pay off later. Also, be really aware of potential workplace and home hazards.
Like what?
If your job involves routine exposure to chemicals, heavy metals like lead or mercury, certain biological agents, or radiation, or even if you have to stand constantly or do heavy lifting, you need to discuss these with your provider and possibly your employer right away to make adjustments.
Okay.
At home, be mindful of things like lead in old paint or pipes, mercury in certain types of fish, like shark or swordfish, some pesticides, and even cat litter due to the risk of toxoplasmosis. It's best if someone else handles the litter box duty if possible.
Good practical tips. Okay, rounding the corner into week 4. This is often a celebratory moment for many. The potential for that positive pregnancy test.
A big moment.
Right. Home pregnancy tests work by detecting that HCG hormone we talked about in your ear.
That key hormone.
Exactly. And while some tests claim they can detect pregnancy incredibly early, the general advice is still to wait until the first day of your missed period.
Right.
For accuracy.
Generally, yes. That gives the most reliable results and helps you avoid those frustrating false negatives or those maybe not faint lines. You want a clear answer if possible.
Makes sense. Get a clear yes or no.
Right. And if we connect this to the bigger picture, week 4 is often when your estimated due date gets calculated.
How do they figure that out?
Your provider will typically base it on the date of your last menstrual period, or if you happen to know it precisely, the date of conception. But, and this is really crucial to remember, a due date is just an estimate.
Only an estimate.
Absolutely. Only about 1 in 20 women actually deliver on their exact due date. You're just as likely to go into labor any day within the 2 weeks before or the 2 weeks after that date.
Good perspective to keep. So, developmentally, what's the big news this week?
This week marks a really profound transformation. Your baby-to-be officially transitions from being a blastocyst to becoming an embryo.
Embryo stage. And size-wise?
Tiny. About the size of a poppy seed. It's an incredibly small mass, but astonishingly complex already.
Wow.
It now consists of 2 distinct layers, called the hypoblast and the epiblast. And from these 2 layers, all of the baby's future organs and tissues will begin to develop over the next crucial 6 weeks or so.
So this is like the absolute blueprint being laid down.
Exactly. It's the foundational blueprint.
That's astounding. All major systems forming from just 2 basic layers. Can you help us visualize how each of those layers contributes? What do they become?
Absolutely. It's a period of truly rapid cell multiplication and differentiation. Things are changing fast. The outer layer, the ectoderm, is amazing. It's responsible for forming the neural tube.
Which becomes the brain and spinal cord.
Precisely. Brain, spinal cord, and all the nerves. Plus, it also develops into the skin, hair, and nails. Quite a job.
Wow. And the middle layer?
That's the mesoderm. This is where the heart and the entire circulatory system start to form, along with all your baby's muscles and bone.
Okay. Heart circulation structure.
Right. And then the innermost layer, the endoderm, will give rise to vital internal organs like the lungs, the intestines, the urinary system, plus the liver and pancreas.
So basically everything essential.
Everything essential is starting right now. It's like a miniature, perfectly orchestrated construction project happening at lightning speed.
Incredible. And what about the support systems, the things that sustain the embryo? Are they forming now too?
Yes, absolutely. While the baby is rapidly developing, its critical support systems are also building out their infrastructure. That primitive placenta is starting to tunnel into the uterine lining.
Making connections.
Exactly. Creating tiny, intricate spaces for your blood to flow into. This allows it to start providing nutrients and oxygen directly to the growing embryo, and just as importantly, removing waste products.
Okay.
Additionally, the amniotic sac forms around the embryo. This creates that protective, fluid-filled cushion.
The water bag.
Essentially, yes. And a yolk sac also develops. This structure temporarily provides nourishment to the embryo and produces cells that will later contribute to forming the umbilical cord, parts of the gut, and even early reproductive cells. It's a whole complex, self-sustaining little ecosystem being built.
Wow. With all this rapid, unseen change happening, what symptoms might someone start to notice in week 4 as their body adapts? Are things becoming more obvious?
Maybe. By now, many women begin to report tender or swollen breasts. That's often due to increased blood flow and those surging hormonal changes we keep mentioning.
Makes sense.
Fatigue is also a very, very common early sign. It's likely caused by that dramatic surge in progesterone, which is essential for maintaining the pregnancy, but can definitely leave you feeling utterly drained.
The pregnancy nap becomes essential.
It really can. Nausea and vomiting, classic morning sickness, can actually begin as early as week 4 for some people, although it typically ramps up later in the first trimester.
Okay.
You might also experience more gas and bloating, often because progesterone slows down digestion,
Fun times.
right? But, and this is really important to repeat, many women feel absolutely no symptoms at all this week, and that is completely normal and definitely no cause for concern. Every single body is different.
Good reminder. And what about that highly anticipated baby bump? Is it making an appearance yet, or is it too early?
Way too early for a true baby bump. At this stage, any noticeable bump you might feel or see is almost certainly just due to bloating, not the uterus actually growing out of the pelvis yet.
Okay, so it's digestive changes mostly.
Pretty much. The uterus itself is still very small, maybe the size of a small pear, and it remains entirely contained within the pelvis at this point.
So maybe time for comfy pants.
Definitely.
Mhm.
We always suggest wearing comfortable, loose-fitting clothes during this phase. Your regular pants might suddenly start to feel a bit snug around the waistline, not from baby growth yet, but from that bloating and those digestive shifts.
Got it. So as you officially navigate early pregnancy, possibly with a positive test in hand, what should be on the checklist for week 4? What's the very first medical step?
Okay, now that you've likely had that positive test, it's definitely time to make your first prenatal appointment.
When do those usually happen?
Many healthcare providers will schedule this first main visit for around 8 weeks of pregnancy. But if you have any existing medical conditions, or maybe you've had complications in previous pregnancies, they might want to see you sooner just to establish care and check things out.
Makes sense.
It's also a crucial time for a thorough medication review. You need to meticulously check all medications prescription, over-the-counter, even herbal supplements with your provider to ensure they are absolutely safe for pregnancy.
Super important.
Very. If anything isn't safe, your doctor or midwife can help you find alternatives or adjust dosages. And for soothing any digestive issues like gas or bloating that might be starting,
Any tips?
try eating smaller, more frequent meals throughout the day. Eat slowly, chew your food really thoroughly, and maybe try to avoid carbonated drinks, chewing gum, and artificial sweeteners like sorbitol. Those can all contribute to gas for some people.
Good practical advice. And finally, what about looking ahead, mentally preparing for the journey?
We really encourage you to do just a quick, overarching pregnancy overview. You don't need to become an expert overnight,
Right.
but just getting a general sense of what's ahead in the coming months, the key milestones, the common symptoms you might expect, the typical tests. It can really help reduce anxiety and build excitement.
Kind of demystifies the process a bit.
Exactly. It helps you understand the incredible journey you're on and feel a bit more in control and informed right from the start.
Okay, now as we round the corner into week 5, prepare for a week where things truly start to shift, both for the tiny embryo and for how you might be feeling.
Things ramp up.
Yeah, your embryo is still incredibly tiny, maybe like a sesame seed now.
So small.
But internally, massive, rapid changes are unfolding. This is often the week when you might truly start feeling pregnant, with those more pronounced symptoms really making their presence known for many.
Developmentally, the embryo now looks remarkably like a tiny tadpole.
Hmm.
But don't let that size fool you. Those 3 foundational layers, the ectoderm, mesoderm, and endoderm, they're working overtime, orchestrating the formation of all the future organs and tissues.
Still building that blueprint.
Yes, and crucially, the neural tube, which is the precursor to the baby's entire brain and spinal cord, is rapidly developing from the ectoderm. And within the mesoderm, an absolutely astonishing milestone occurs.
What's that?
Cardiac activity begins in the heart tube. This is the very first flicker of your baby's heart.
Wow, already.
Already, it's a truly awe-inspiring moment, even before the heart is fully formed into chambers, just that initial electrical activity starting.
That's incredible. So what are the common symptoms someone might experience now that things are really kicking into gear and the body is actively establishing this pregnancy?
Well, by week 5, frequent urination often becomes noticeably more common.
Why is that happening so early?
It's a direct result of hormonal changes, and your body's significantly increasing blood volume. Your kidneys are working harder, processing more fluid, and your bladder might feel fuller faster.
Okay, makes sense.
Continued breast tenderness and swelling are also common as those milk ducts begin to prepare. and that pervasive bone-crushing fatigue.
Still hanging around.
Oh, yes. Likely due to that dramatic rise in progesterone and just the sheer energy your body is expending on this massive project. It can feel really overwhelming.
I bet.
Spotting is relatively common. Remember, about 1 in 4 women experience some in the first trimester. But it's always worth reporting to your provider just in case, as it can sometimes signal other issues.
Always best to check.
Always. And for many, this is also the official start of more noticeable morning sickness, along with distinct food aversions, often amplified by that dramatically heightened sense of smell we talked about.
So things you used to love might suddenly be repulsive.
Exactly. It's a common but definitely challenging aspect of early pregnancy.
And the belly. Still no bump, I imagine, but maybe a feeling of general expansion.
That's right. A visible, true bump from the uterus is still pretty rare at this stage. However, bloating can definitely make your midsection feel thicker or your regular clothes feel quite snug.
Okay. What about weight gain at this point?
Well, the general recommendation is about 1 to 5 pounds of gain for the entire first trimester.
The whole 13 weeks.
Yes. So at week 5, it's perfectly understandable and okay if you haven't gained much weight or maybe even lost a little, especially if you're struggling with nausea.
The baby's still so tiny, it doesn't need much extra yet.
Exactly. Your body's really focusing on that foundational development right now, not necessarily packing on pounds.
Got it. For week 5, what's on the practical checklist? How do you choose the right medical guidance and what foundational health info should be gathered?
Okay, first priority, if you haven't already, is choosing your healthcare provider.
OBGYN or midwife?
Right. If you don't already have one you trust and feel comfortable with, now's the ideal time to start researching and making that crucial decision. You want someone who's a good fit for you.
Definitely.
And connecting with that, it's also incredibly important to gather your family health history, both sides of the family.
What kind of information?
Talk to relatives about any chronic conditions, significant medical histories, or any genetic abnormalities that might run in the family. Your provider will want this info to get a complete picture of any potential risks or considerations.
Good to have it ready for that first appointment?
Exactly. And of course, keep taking those prenatal vitamins, especially the folic acid, and diligently limit your caffeine intake to under that 200 milligram per day mark. These foundational health practices are just so crucial right now.
Okay, week 6. This brings a truly significant milestone, and it's one of the most exciting early moments for many parents to be. Potentially hearing the baby's heartbeat.
Yes, this is a big one.
So while the heart isn't fully developed into its 4 chambers yet, those specialized cells in the heart tube have started beating rapidly.
Incredibly rapidly, around 160 times per minute, which is about twice as fast as your own resting heart rate.
Wow. And you might actually hear this.
You might. If you have an early vaginal ultrasound this week, you may hear this incredible sound, often described as like galloping horses.
Galloping horses. That's amazing.
It's an incredibly powerful moment, that tangible sign of the life growing inside.
Absolutely. Developmentally, what else is remarkable this week? I heard facial features start forming.
They do. What's truly remarkable here is the rapid formation of facial features, even at this microscopic stage. If you could look super closely, you'd see dark spots where the baby's eyes and nostrils are starting to form.
Wow.
And small depressions marking the emerging ears on the sides of the head. Internally, inside their tiny mouth, the tongue and vocal cords are beginning to develop.
Laying the groundwork for sound later on.
Exactly. Additionally, the arm and leg paddles, which were just buds before, are now starting to lengthen, though they still look very primitive, not like distinct limbs yet.
Little paddle.
Little paddles. And the backbone also extends into a small temporary tail, which will typically disappear within the next few weeks as the lower body develops further.
A temporary tail. Fascinating. What kind of symptoms are commonly reported in week 6? I imagine for many, morning sickness is really starting to make its presence known.
Indeed. Morning sickness often intensifies significantly for many around week 6. And remember, it can strike at any time of day, not just the morning.
All-day sickness might be more accurate for some.
For many, yes. Frequent urination usually continues thanks to increased blood flow and hormones. Mood swings can also really flare up.
Why is that?
It's a complex interplay of stress, fatigue, those surging hormones, and just the sheer emotional weight and magnitude of becoming a parent. It's a lot to process.
Totally understandable.
Breast tenderness and swelling are usually still very present, and that pervasive fatigue can feel absolutely bone-crushing for some.
Keep napping.
Yes. Some women also notice a distinct metallic taste in their mouth, which is likely due to an estrogen surge. And many report experiencing strange, vivid dreams as their subconscious works through all these massive life changes. Headaches are also common too.
Okay. You mentioned spotting earlier. What's the important note on bleeding this week? When should someone be concerned?
Right. It's important to reiterate that approximately 1 in 4 women experience some form of bleeding or spotting during the first trimester.
That common.
It is.
Yeah.
And it's usually minor, often related to implantation or cervical sensitivity. But, and this is the key part, it always needs to be checked by a healthcare provider.
Always call, no matter how light.
Absolutely. While it could be something completely innocuous, it could also, in some cases, signal more serious issues like an ectopic pregnancy where the embryo implants outside the uterus, or an early miscarriage.
Yeah.
So if you see any bleeding at all, don't hesitate. Reach out to your doctor or midwife immediately for assessment. Better safe than sorry.
Definitely good advice. And as for the belly, when does a visible bump usually show up? Are there factors that make it appear earlier for some people?
It's highly variable, really depends on the person. Factors like the baby's position inside the uterus, your own height, and torso length.
Ah, okay.
Also, whether you're expecting multiples, twins, or more will definitely show sooner. And if you've had previous pregnancies,
Why do previous pregnancies make a difference?
well, women who've been pregnant before often show earlier because their abdominal muscles and ligaments have already been stretched and might offer less resistance to the expanding uterus this time around.
Makes sense.
Also, shorter women or those with the shorter torso tend to show earlier just because there's less vertical space for the uterus to expand upwards before it has to pop outwards. But at 6 weeks, it's still very early for a true discernible bump for most people.
Got it. What should be on the comprehensive checklist for week 6? What kind of preparation is needed for that first big prenatal visit? And what essential health knowledge should be gained?
Okay, preparing for your first prenatal visit is key. Think beyond just the basics. What do you really want to discuss?
Like what?
Well, gather your detailed health history, your family history like we discussed. Be ready to talk about your lifestyle habits, and definitely write down any specific concerns or questions you have. This is your chance to really engage with your provider.
Be an active participant.
Exactly. It's also crucial now to really research food safety in depth. Know what's definitely off limits?
What are some common examples?
Things like cold deli meats unless heated until steaming hot, raw oysters or other raw shellfish, unpasteurized juices or dairy products, and certain types of fish high in mercury like shark, swordfish, king mackerel, tilefish. Understanding the risks is vital.
Good to know. What about prenatal testing?
You should start exploring prenatal testing options with your provider. There are screening tests, usually blood samples, and ultrasound measurements.
NIPT is one of those.
NIPT is a type of screening, yes. They assess your baby's risk for conditions like Down syndrome and other chromosomal differences. These are non-invasive.
Okay.
If a screening test comes back indicating a higher risk, then you might discuss diagnostic tests like chorionic villus sampling, CVS, or amniocentesis. These provide definitive genetic answers, but do carry a very small risk of complications. The decision is always personal, made with your medical team.
Right, informed choice. And thinking about daily life like work or just overall mental well-being, what proactive steps can be taken now?
Good question. It's wise to consider workplace safety. If your job involves routine exposure to things like chemicals, heavy metals, certain biological agents, radiation, or castle requires constant standing or heavy lifting.
Talk to someone.
Yes, you need to discuss this with your employer and your healthcare provider as soon as possible to make necessary adjustments or maybe even get temporary reassignments if needed.
Protect yourself and the baby.
Exactly.
Yeah.
Lastly, and very importantly, prioritize stress reduction. High levels of chronic stress aren't good for you or your developing baby. Find what works for you. Practice consistent self-care. Maybe it's connecting with positive people, taking regular short breaks during the day, deep breathing exercises, gentle exercise like walking, listening to calming music, or journaling your thoughts. These practices can make a huge difference.
Definitely sounds helpful. Okay, entering week 7, your baby is now about the size of a blueberry.
Getting bigger. Still tiny, though.
Still tiny, but the cellular growth inside is absolutely astounding. I read somewhere it's around 250,000 new brain cells forming every single minute.
The rate of development is just mind-blowing.
Right. And while still tiny, there's increasing definition to those facial features we mentioned, starting to hint at the tiny face to come.
Developmentally, this week sees truly significant progress, especially in sensory organs and internal systems. The main parts of the eye, the cornea, iris, pupil, lens, retina, they're further developing and will be almost fully formed in just a few weeks.
Wow. But they stay closed for a long time.
They do. Fascinatingly, the eyelids will stay fused shut until around 27 weeks of pregnancy.
Amazing. What else is happening inside?
Inside, the stomach and esophagus begin to form, creating that essential pathway for future food movement and digestion. Your baby's liver and pancreas are also starting their crucial development now.
Vital organs kicking off.
Yes, and critically, that neural tube we talked about has successfully closed on both ends now. The brain has three distinct and rapidly developing areas: the forebrain, midbrain, and hindbrain. It's laying the foundational groundwork for all complex future functions. It's just a marvel of biological engineering.
Absolutely incredible. What are the common symptoms this week, especially with that consistently heightened sense of smell still going strong?
Oh yeah, that super sniffer ability and the accompanying food aversions are very much still in play, often intensifying due to rapidly increasing estrogen levels.
So things you used to love might now trigger gagging.
It's possible.
Yeah.
Common smells, even ones you used to find pleasant, can be surprisingly off-putting. Frequent urination usually continues, as do those mood swings, which can range from tearfulness to irritability again, hormones, and just the reality of big life changes.
Makes sense.
Another symptom many experience is excessive saliva production, known as tyolism.
More saliva. Why?
It can be linked to hormonal changes, but also sometimes connected to persistent nausea or heartburn. It's just more spit,
Lovely.
right? Constipation is also quite common, as progesterone relaxes smooth muscles everywhere, including the digestive tract, slowing things down. And heartburn, that uncomfortable burning sensation, can also begin to emerge now for some.
Okay. But what if someone isn't feeling any of this?
We really want to strongly reassure you. If you still feel no symptoms at all, or maybe they seem to come and go, that's also completely normal. Absolutely no reason for concern. Every single pregnancy is unique. Don't compare yourself.
Good reminder. And the belly. Still likely pretty discreet, or are there any external changes starting to hint at pregnancy?
Yeah, the belly itself is still likely very discreet. Probably no visible bump at week 7, especially if you wear loose clothing. However,
Breasts.
you might definitely start to notice significant changes in your breasts. They may feel noticeably bigger, heavier, maybe even itchy as the skin stretches to accommodate the increased size.
Stretch marks starting already.
Some might see the very first subtle ones. It's quite common to go up a cup size or even 2, especially with the first pregnancy, as your body really gears up for its future role in feeding the baby.
Okay. Let's talk about the checklist for week 7. What should be top of mind for nutrition, partner involvement, and maybe sharing the big news?
Nutrition is always important, but especially now. Even if nausea makes eating feel like a chore, do your absolute best to focus on key pregnancy superfoods.
Like, what are we aiming for?
Prioritize protein, healthy fats, and those essential vitamins and minerals like folic acid, iron, and calcium. Think easily digestible but nutrient-dense options. Maybe scrambled eggs, baked salmon, different kinds of beans, delicious sweet potatoes are great examples. Find what you can tolerate.
Good ideas. And connecting with your partner during this time seems really important.
Incredibly crucial. While you're the one experiencing all the physical realities, there are countless ways your partner can actively share in the pregnancy journey.
Wow.
Make dedicated time for date nights, even if it's just cozying up on the couch. Talk openly about parenting together. Share your hopes and fears for the future. The more you bond and communicate now, the better equipped you'll be to navigate the amazing challenges and joys of new parenthood as a solid team.
Teamwork makes the dream work.
Exactly. And for a bit of fun, this is a popular time for trying those old wives' tales for gender prediction. You know, the ring test, or looking up a Chinese gender predictor chart.
Do they actually work?
Well, they have a 50-50 chance of being right. It's just for fun, definitely not scientific.
Right, just a bit of fun. And for many, the big personal question of when do we announce is probably looming large.
Oh, that's a deeply personal decision. There's truly no right or wrong answer.
What do most people do?
Some choose to wait until after the first trimester, usually after week 12, when the risk of miscarriage drops significantly. It offers a sense of security before sharing widely.
Okay.
Others feel more comfortable sharing the news right away with close family and friends for support.
And what about telling work?
That also varies. Some wait to avoid potentially being treated differently, or maybe until their maternity leave plans are more solid. Others want their colleagues to understand why they might be feeling a bit off, green around the gills or needing more breaks. It really depends on your workplace and your comfort level.
Makes sense. Personal choice.
Totally. And of course, thinking about creative reveal ideas, whether it's a cute social media post or a small gathering, that can be a fun and memorable part of the whole process.
Okay, moving into week 8. Your baby is now the size of a raspberry.
Still small, but growing.
And here's an amazing fact. Your baby is actually moving now. Plus, those little webbed fingers and toes are starting to sprout and develop, taking on a more recognizably human form.
What's fascinating here is that while your baby is indeed making tiny movements, these aren't the kicks or flutters you'll actually feel yet.
Oh, okay, so they're moving, but I can't feel it.
Exactly. They're more like spontaneous twitches and stretches, which might be visible if you happen to have an ultrasound right now. You typically won't feel consistent fetal movement, often called quickening, until sometime between 16 and maybe 22 weeks.
Good to know. Manages expectations. What else is happening developmentally?
Internally, the respiratory system is rapidly forming. Breathing tubes are extending from the throat down towards the developing lungs. And there's also this rapidly spreading nerve network.
Like wiring everything up.
Pretty much, making intricate connections not only within the brain, but also out to the muscles, eyes, and ears. It's building the foundational wiring for future coordinated movements and all those sensory experiences. It's a really complex biological dance.
Incredible. What about the symptoms this week? I've heard breast changes can be quite significant, maybe even needing new bra sizes already.
They absolutely can be. You might also notice an increase in that white, creamy vaginal discharge known as leukorrhea.
Is that normal?
Very normal. It's due to higher estrogen levels and increased blood flow down there. As for breasts, yes, rising hormone levels are causing them to grow significantly as they prepare for milk production.
So bra shopping might be necessary.
Don't be surprised if you go up a cup size or even two. You might well need to invest in some supportive, comfortable maternity bras soon. You might also notice more visible blue veins across your breasts.
Why the veins?
Increased blood volume supplying the area. Also, maybe darker nipples and more pronounced little bumps on your areolas. Those are called Montgomery's tubercles, and they produce oils to keep the nipple area lubricated.
Wow, lots of changes there. What else?
Abdominal bloating is still a common companion for many, as are that heightened sense of smell and those persistent food aversions. Many women also report strange, vivid pregnancy dreams.
The subconscious working overtime.
Could be. Processing all the excitement, anxieties, and profound changes of becoming a parent. Headaches are common too, influenced by blood flow changes, fatigue, stress, maybe even caffeine withdrawal if you've cut back.
Now, this is also when some women unfortunately experience a much more severe form of morning sickness, right? Not just the typical nausea.
Yes, it's really crucial to talk about hyperemesis gravidarum, or HG.
What is HG exactly?
While most women experience some degree of nausea and vomiting in early pregnancy, about 3% experience HG. It's an extreme, debilitating form that can lead to severe dehydration, significant weight loss, and nutritional deficiencies. It's serious.
So, when should someone definitely call their doctor? What are the warning signs?
You must call your provider immediately if you absolutely cannot keep anything down, including small sips of water or fluids, if you vomit blood, if you've lost more than 5 pounds quickly, if you feel consistently weak, faint, or dizzy, or if you have a fever or abdominal pain, along with dark, strong-smelling urine.
Okay, those sound like clear signs to seek help.
Absolutely. These are serious symptoms that require immediate medical attention and intervention, often involving IV fluids or medication. Don't suffer through it thinking it's normal morning sickness if it's that severe.
Good advice. And the bump. Is it getting harder to hide for those who aren't ready to announce yet?
It might be. While a true pregnancy bump from the uterus growing is still early for many, your overall body changes, particularly the bloating, and that noticeable breast growth might be getting harder to conceal under regular clothes.
So, time for strategic dressing.
Might be. If you're not ready to announce, you might find yourself reaching for looser clothing. Think oversized cardigans, flowy tops, maybe maxi dresses. And it's worth saying, the first trimester often isn't that pregnancy glow phase people talk about.
Oh, really?
For many, persistent fatigue and nausea can lead to dark circles under the eyes, or even a pale, slightly greenish tint to the skin, what some jokingly call being green around the gills.
Not so glamorous yet.
Not always. But rest assured, that anticipated glow often does arrive beautifully in the second trimester as symptoms hopefully subside.
Something to look forward to. What should people be doing on their checklist for week 8? What about documenting changes and supporting mental well-being?
Now's actually a great time to start documenting that bump, even if it feels more like bloating right now. Taking weekly photos creates a really fun time-lapse record of your pregnancy journey that you'll probably treasure later.
Cute idea.
Also, really seriously, consider your mental health. Pregnancy is a time of immense emotional change. If mood issues, feeling sad, anxious, overwhelmed, persist for more than 2 weeks, it's vital to maybe take a prenatal depression screening quiz online and definitely discuss it openly with your healthcare provider.
It's okay to ask for help.
Absolutely. These issues are common, they're not a sign of weakness, and help is readily available through therapy or sometimes medication. Don't go through it alone. Optimizing sleep is also critical.
Because that fatigue is real.
So real. Combat sleep disturbances like peeing frequently, nausea, heartburn, leg cramps, maybe even snoring by aiming for earlier bedtimes and practicing excellent sleep hygiene.
Sleep hygiene, like washing.
No. It means sticking to a consistent sleep schedule, creating a comfortable, relaxing bedtime routine, and making your bedroom as dark, quiet, and cool as possible. Basically, optimizing your environment for sleep.
Got it. Good tips.
And don't forget sunscreen. Using SPF 30 or higher daily helps significantly prevent melasma.
Melasma, what's that?
It's sometimes called the mask of pregnancy. These are those darker, sometimes patchy areas of skin that could appear on your face due to hormonal changes, especially when exposed to the sun. Sunscreen is your best defense.
Good to know. And weight gain.
Understand the target weight gain. If you started pregnancy at a healthy weight, the general guideline is to aim for about 1 to 5 pounds of gain in the entire first trimester, then roughly a pound a week after that. It helps ensure adequate nutrition.
Okay. As we transition into week 9, your baby is now grake-sized.
Growing steadily.
And here's another incredible milestone. Your baby now has all essential body parts, including distinct elbows and knees. And this is also a truly pivotal week for the placenta, right?
Yes. Here's where it gets really interesting with the placenta. This week, it typically becomes developed and organized enough to take over most of the critical job of producing the hormones needed for the baby's growth and development.
So it's taking charge now.
It is, effectively replacing the yolk sac's earlier role in hormone production. This is a quiet but profound revolution happening inside. By the end of your pregnancy, this amazing organ will be about 9 inches across and an inch thick, a true powerhouse.
Incredible. What other fascinating developments are happening with the baby?
Well, believe it or not, 10 tiny tooth buds are developing within each gum band. These will eventually become the baby teeth, just waiting beneath the surface.
Tooth buds already.
All 4 chambers of the heart are now fully formed, and that galloping horse's heartbeat we talked about is even more pronounced and powerful. Your baby can also begin to flex joints like elbows and knees, showing early signs of muscle control.
Little flexes.
Yeah. And their fingers and toes are becoming much clearer and more defined, losing that earlier webbed appearance. More like tiny human hands and feet.
Amazing detail. With all these intensive internal changes, what symptoms are prominent for the parent in week 9, especially regarding appetite and digestion?
Food cravings often become more noticeable now. Again, likely influenced by those extreme hormonal shifts impacting taste and smell.
Are cravings linked to what the body needs?
Sometimes, maybe, but honestly, while some experts suggest they might be linked to subtle nutritional needs, many believe they're just another fascinating, sometimes weird, part of the hormonal roller coaster of pregnancy. Don't read too much into them.
Okay, just roll with the pickle cravings.
Pretty much. Alongside cravings, food aversions, and that heightened sense of smell often persist or even peak around now. And morning sickness can also reach its peak around week 9 for many women.
Why does it peak now?
Some evolutionary theories suggest this intensity might actually serve a protective function, making you averse to potentially harmful foods or toxins during this absolutely critical period of rapid organ formation. But that's just a theory.
Interesting thought.
Heartburn, that uncomfortable burning sensation, and constipation also remain common issues due to both hormonal relaxation of digestive muscles and the physical changes as your uterus starts to grow, slowing everything down.
Still dealing with digestion?
Often, yes. It's a common first trimester complaint.
What's on the comprehensive checklist for week 9? How can parents-to-be connect with their baby, and what practical advice is there for well-being and safety?
This is actually a beautiful time to start creating a daily ritual to connect with your baby, even though they're still so tiny inside.
What kind of ritual?
It could be anything that feels right for you. Maybe just some quiet reflection time each day, journaling your thoughts and feelings to the baby, or even writing little letters to them. It's a wonderful way to begin that bonding process and mentally prepare for parenthood.
Nice idea. And partner involvement?
Increasingly important to involve your partner actively. Encourage them to talk to the baby. The baby can't hear yet, but it's about the connection. Read pregnancy books or apps together so you're both learning. make joint decisions about things coming up. It fosters teamwork.
Good point. What about exercise?
Exercise remains key. Walking is a safe and highly recommended activity throughout pregnancy. It's fantastic for boosting energy and mood. Just remember the basics. Protect your skin with SPF, stay well hydrated, maybe have a small, protein-rich snack before you go to maintain energy.
Okay. And vaccinations, still important.
Yes, definitely reinforce the importance of vaccinations. The flu shot and the COVID-19 vaccine are safe and strongly recommended for all pregnant women.
Why are they so important during pregnancy?
They significantly lower your chances of getting severely ill or hospitalized. But crucially, the antibodies you develop after vaccination pass directly through the placenta to your baby.
So the baby gets protection too.
Exactly. It provides vital protection after birth, especially since infants under 6 months old can't be vaccinated themselves against flu or COVID yet. It's a gift of immunity.
Great reason to get them. Anything else safety-wise?
Be acutely aware of household chemicals. Take a look at your cleaning products, any pesticides you use, paints, solvents. Check for lead, especially in older homes with old paint or pipes. Some of these can be harmful, so avoid them or use them with extreme caution and good ventilation, or have someone else handle them if possible.
Good checklist. All right, let's step into week 10. Your baby is now the size of a strawberry.
Sweet.
This week brings some important milestones, especially around monitoring the baby's health and maybe starting to anticipate that honeymoon phase of pregnancy people talk about.
Yeah, getting closer to the second trimester. What's truly fascinating here is that you might hear your baby's heartbeat for the first time with a handheld fetal Doppler during your prenatal visit around this time.
With the Doppler, not just ultrasound.
Potentially, yes. It depends on the baby's position and your provider's equipment, but it's possible starting around now. It's that rapid, distinct galloping horse's sound, and hearing it is incredibly reassuring for many parents.
I bet. What about testing this week?
This week also often marks the window for the NIPT blood test, or non-invasive prenatal testing.
Remind us what that is.
It's an advanced screening test. It analyzes tiny fragments of fetal DNA that are naturally circulating in your blood.
Wow. What does it screen for?
It screens for the risk of certain chromosomal conditions like Down syndrome, trisomy 21, Edwards syndrome, trisomy 18, and Patos syndrome, trisomy 13. And it can also very accurately tell you the baby's gender if you choose to find out that early.
So it's just a blood draw from the mom.
Exactly, non-invasive. Some doctors might also do early ultrasounds, maybe between 6 to 10 weeks, often transvaginally, using a probe inserted into the vagina for a clearer view, especially if there's a history of complications like miscarriage or ectopic pregnancy, or just to confirm the dating of the pregnancy.
Okay. What's happening developmentally within the baby at this strawberry-sized stage? What visible changes might we note if we could kick inside?
Well, the eyes are fascinatingly fully formed now. All the intricate parts, like the cornea, iris, pupil, lens, retina, are there. But as we said, the eyelids stay fused shut until much later, around 27 weeks.
Protecting the developing eyes.
Seems like it. Your baby's tiny teeth, those buds we mentioned, are starting to harden now and connect to the jawbone, even though they won't actually erupt through the gums until months after birth.
Amazing.
Early brain development is causing the forehead to temporarily bulge out quite a bit. It actually measures about half the baby's entire length at this stage. It just shows how much rapid neural growth is happening.
Brain power.
Definitely. This week also sees the development of synapses, connections between nerves and the spinal cord. This allows for those early limb and finger movements, though still way too subtle for you to feel.
So much going on. And what about symptoms for the parent? What can they expect at week 10 as the body continues its incredible adaptations?
You might notice a definite thickening in your midsection. Maybe not a bump, but just thicker. Likely due to a combo of slight weight gain and that persistent bloating.
Making pants uncomfortable.
Definitely making pants with fixed waistbands. Pretty uncomfortable for many. Stretchy waistbands and leggings might quickly become your new best friends around now.
Comfort is key.
Absolutely. That excess saliva production, sialism, can still be quite common, especially if you're still feeling nauseated. Drinking more water or chewing sugar-free gum can sometimes offer relief.
Okay.
Vaginal discharge might increase again due to higher estrogen. Healthy discharge is typically milky white, thin, and mild smelling. Generally nothing to worry about unless it changes significantly.
Good to know.
You might also notice those newly visible blee veins across your chest, breasts, and maybe your belly becoming more prominent. That's because your body is producing significantly more blood, up to 50% more by the end of pregnancy, to support everything.
Wow, 50% more blood.
Incredible, right? Mood swings often continue those moments of elation, mixed with feelings of sadness or overwhelm.
Hmm.
Hormones, stress, fatigue, plus just processing, becoming apparent. It's all part of it.
And morning sickness. Any light at the end of the tunnel?
Good news. Morning sickness often reaches its peak around weeks 9 or 10 when those HCG hormone levels are highest. For many, significant relief is just around the corner as HCG levels start to gradually fall around week 11 or 12. Hang in there.
Hope on the horizon.
Yes, though dizziness can also occur sometimes as your body adjusts to that dramatically increased blood volume pumping through your veins. Stand up slowly.
Good tip. And those belly changes. Is it still totally normal not to show a distinct bump yet?
Absolutely. 100% normal. While your belly might look a bit rounder or feel thicker,
Yeah.
especially if this isn't your first pregnancy, those muscles might be looser. It's completely normal if you see no visible difference at all yet. Your body type, your height, previous pregnancies, they all play a big role in when a true bump becomes visible. Remember that recommended first trimester weight gain is only 1 to 5 pounds total.
So don't stress if you're not showing.
Please don't.
Okay.
The uterus is still largely contained within the pelvis for most people at this point.
Got it. What's on the checklist for week 10? Beyond the physical, what about things like financial planning and self-care strategies?
This is actually a really great time to sit down and review your finances comprehensively.
To practical stuff.
Yep, a new baby brings a whole host of new expenses. So creating a new budget, looking into life insurance or maybe disability insurance, understanding potential tax implications, these are all wise, proactive steps.
Get ahead of it.
Exactly. Trying prenatal yoga can be highly beneficial too, if you haven't started.
Why yoga specifically?
It focuses not just on safe stretching and strengthening for your changing body, but also really emphasizes breath awareness, which is incredibly helpful for coping during labor and birth. Plus, classes offer a supportive community of other pregnant women, whether you find them online or in person.
Community sounds nice. What about managing that lingering morning sickness?
Keep focusing on small, frequent meals. Don't let your stomach get totally empty. Try cold foods. They often have less smell and can be easier to tolerate. Maybe avoid strong cooking smells by having someone else cook or opting for simple meals or takeout. And always consult your provider about safe anti-nausea medications if it's severe and impacting your life. Don't just suffer.
Good point. Anything else health-wise?
Be aware of UTIs, urinary tract infections. They're unfortunately more common during pregnancy.
What are the symptoms?
Painful or burning urination. Feeling like you have to pee all the time, even if little comes out. Pelvic discomfort, or maybe cloudy or foul-smelling urine. If you suspect one, see your caregiver right away. They need to be treated with antibiotics promptly, as untreated UTIs can lead to kidney infections or other complications.
Okay, watch out for those. And announcing the pregnancy.
Right, time to maybe decide when and how you'll officially announce your pregnancy more widely, if you haven't already. There's no single right way or time. Some tell close loved ones first, then maybe work a bit later, giving you time to plan for leave and everything. It's your news to share when you're ready.
Okay. As we move into week 11, your baby is now the size of a fig.
Getting fruity.
Right. You're nearing the very end of the first trimester now, and internally, some truly big organ developments are happening, preparing the baby for more independent function down the line.
Developmentally, this is a big week for details. Your baby's tiny fingers and toes have now completely lost that webbing they had earlier. They're becoming distinct and longer, really showcasing a more refined human form.
Wow! Separate little fingers and toes.
Exactly. And this is also the week where pretty much all your baby's vital organs are truly in place, and many are actively starting to function.
Like what? What's starting to work?
For instance, the liver is now making red blood cells, taking over that job from the yolk sac. The kidneys are beginning to produce urine. The pancreas is starting to make insulin, that critical hormone for blood sugar regulation.
Amazing systems coming online.
Yes. The heart's 4 chambers are fully formed and beating rhythmically. And while the external sex organs, the penis and scrotum in boys, the clitoris and labia in girls are starting to differentiate.
Can they tell the sex on ultrasound yet?
Probably not easily yet. It will still take several more weeks before the difference is usually clear enough to see reliably on an ultrasound. Patience.
Okay, what else?
The umbilical cord is now super efficiently supplying nutrients and oxygen and removing waste. It's the primary lifeline. And your baby's bones are actively beginning to harden or ossify, becoming stronger.
So much progress. What are the common symptoms in week 11, particularly focusing on the digestive system and maybe the emotional landscape?
Well, constipation, gas, and bloating often persist. Still, those pervasive hormonal changes, slowing down digestion, making your gut feel sluggish,
The joys continue.
they often do. Heartburn is also common, that uncomfortable acid indigestion feeling. It's often due to both hormonal relaxation of the valve between the esophagus and stomach, and maybe starting physical pressure from your growing uterus.
Okay. And emotionally.
Emotionally, you might experience quite conflicting feelings. Maybe moments of intense excitement, followed by nervousness about the unknown, or underlying anxiety about the profound changes ahead. This is completely normal. It's part of processing such a monumental life event.
Acknowledge the feelings.
Exactly. Fatigue is likely still strong for many, but remember that good news. You can often anticipate a significant burst of energy as you transition into the second trimester. That honeymoon phase people talk about is hopefully coming soon.
Fingers crossed.
Increased milky white vaginal discharge usually continues. And while food aversions might still be around due to that heightened sense of smell, for many, they typically start to fade as you enter the second trimester. Headaches can also still pop up. Hormones, stress, congestion, allergies, lack of sleep, dehydration, lots of potential triggers.
Okay. And the belly at 11 weeks, if someone isn't showing yet, is that completely normal? Still okay.
Absolutely. If you don't notice a distinct bump yet, it is totally, completely normal. Every woman's body, every baby bump, they're all different and develop at their own unique pace.
So when does it usually become noticeable?
You'll typically start looking noticeably pregnant when your growing uterus expands up above the pubic bone and begins to push outwards. This might happen around 12 weeks at the absolute earliest for some, but for many women, especially first-time moms, it's often a few weeks later than that.
So it stays hidden for a while.
Before that point, the uterus stays primarily contained within the pelvis and isn't usually visible externally. And remember, factors like your height, your pre-pregnancy weight, and whether you've been pregnant before also significantly influence when you start to show. No stress.
Got it. What's on the checklist for week 11? What about understanding weight gain, building support, and maybe planning for the exciting next phase?
Right. Don't stress excessively about weight gain this early, especially if nausea has been a struggle. Remember, 1 to 5 pounds is the goal for the entire first trimester. It's completely fine if you've gained less or even lost a little. Your body is prioritizing that crucial foundational development right now.
Okay, good reassurance. What about support?
Building your support network is really crucial. Reach out to other moms you know. Consider joining local birth clubs or parenting classes. They offer invaluable advice, understanding, and just that shared sense of community. It helps to know you're not alone.
Definitely. And I heard you mention a baby moon.
Yes. Planning a baby moon can be a fantastic idea. It's like a last hurrah vacation before the baby arrives.
When's the best time for that?
It's often best taken during the second trimester, when energy levels are typically higher and morning sickness has hopefully subsided, making travel much more enjoyable. Think about destinations, any travel safety tips for pregnancy, and what to pack.
Fun thing to plan. Any tips for doctor's appointments? They get more frequent soon, right?
They do. Here's a little pro tip for those prenatal visits, which will become monthly soon. Try scheduling them for first thing in the morning or right after lunch if you can.
Why then?
There's often less of a backlog at those times, so you're less likely to experience long waits in the waiting room. Just a practical tip.
Smart. What about nutrition specifics?
Calcium intake is really vital this week and going forward. Aim for about 1,000 milligrams per day. It's crucial for building strong bones, teeth, nerves, and muscles in your developing baby.
Where do you get calcium?
Dairy products like milk, yogurt, cheese are great sources. Also, fortified foods like orange juice or cereals, canned fish with bones like salmon or sardines, leafy greens. If you don't think you're getting enough through diet, definitely discuss calcium supplements with your provider.
Okay. And skin changes.
Lastly, take care of your skin. While the pregnancy glow might be on its way, pregnancy can bring various skin changes, maybe acne flare-ups, the appearance of varicose veins, that melasma or mask of pregnancy, rashes, itchy skin, the start of stretch marks.
What helps?
Staying well hydrated, diligently using sunscreen every day, and moisturizing regularly can really help manage these common changes and keep your skin feeling as comfortable as possible.
Good advice. Okay, week 12. Your baby is now the size of a lime. And for many parents-to-be, you've reached a truly significant psychological milestone, often a moment of huge relief.
Yes. The end of the first trimester is in sight. And if we connect this to the bigger picture, your uterus has now grown to about the size of a grapefruit. Your healthcare provider can typically feel it low in your abdomen, just above your pubic bone, during an exam.
Getting bigger And the relief part.
Here's some truly happy and reassuring news that brings immense relief for many. Once you've had that first prenatal visit and your baby's heartbeat has been clearly seen or heard, usually via ultrasound by now,
Yeah.
the risk of miscarriage drops significantly, by as much as 80–90%, according to some studies. It's considered very low after this point.
Wow, that's a huge drop.
It really is. And that's also why many people feel more comfortable announcing their pregnancy more widely after reaching this 12-week mark. Plus, all of your baby's vital organs and body parts are now essentially in place.
The blueprint is complete.
The blueprint is basically complete. Now, they'll just continue to develop, mature, and grow bigger throughout the rest of your pregnancy. It's about refinement and growth from here on out.
That's amazing. What exciting new developmental leaps are happening within the baby this week? Things they can do now.
Your baby is making truly remarkable small movements now. They can actually open and close their tiny hands, making a little fist.
Wow.
And they can even curl their little toes. They also have itsy-bitsy fingernails growing.
Fingernails already. Yep.
An interesting and important development is that the intestines, which had been developing so rapidly they briefly protruded into the base of the umbilical cord.
Yeah.
They are now making their way fully back inside the abdomen where they belong. Early reflexes are also working now, and your baby's facial features are becoming much more distinctly human and defined.
More like a tiny person.
Exactly. Even more incredibly, tiny touch pads are developing on your baby's fingertips, the very beginning of their sense of touch and those unique future fingerprints.
Incredible detail. What kind of symptoms are common in week 12? What are some of the less talked about but common physical and emotional changes?
Well, pregnancy stress is still very normal. As the reality of parenthood really sinks in, you might find yourself worrying about the baby's health, the financial implications, the huge life changes ahead. It's okay to feel that. Talk about it. Definitely talk about it. Headaches are also still common. Try those simple remedies like heat or cold packs, a relaxing shower, maybe exploring acupuncture. Acetaminophen, like Tylenol, is generally considered safe during pregnancy if needed, but always check with your provider first.
Okay. What about food issues?
Those challenging food aversions often really start to fade as you enter the second trimester, a very welcome relief for many, though that heightened sense of smell might persist for some.
And fatigue. Still tired.
Fatigue affects about 95% of pregnant women, especially intensely in the first trimester. But again, for most, energy levels will significantly improve as you move into the second trimester. Hang on. Dizziness can still occur due to those big cardiovascular changes.
The extra blood volume.
Exactly. That 30–50% increase in blood volume can sometimes lead to temporarily lower blood pressure, making you feel dizzy if you stand up too fast. And you might experience some shortness of breath.
Well, shortness of breath already.
Your body just needs more oxygen now for you and the baby. And progesterone actually works to expand your lung capacity, encouraging deeper breaths, which can sometimes feel like shortness of breath. However,
When to worry.
any severe or sudden shortness of breath, especially if it comes with chest pain or an irregular heartbeat, should always be reported to your provider immediately. Don't ignore those signs.
Good distinction. And clothes. Is it finally time to hit the maternity shops, or are there still smart clothing hacks to get by?
It truly depends on your body and your comfort level. Many women are still perfectly comfortable in roomier items from their existing wardrobe. Think loose dresses, leggings, flowy tunics.
The hair tie trick.
Absolutely. There are great clothing hacks, like using a simple hair tie looped around your pants button and through the buttonhole to magically create more waistline room, or belly bands that cover unbuttoned pants. But once your belly truly starts to pop and becomes more pronounced, maternity clothes often just become the most comfortable and flattering option. They're designed for it.
How do maternity sizes work?
Generally, they align with your pre-pregnancy size. So if you typically wore a size 8 before pregnancy, you'd likely look for a maternity size 8. They account for the growing belly and other changes.
Helpful tip. What should be on the comprehensive checklist for week 12? Thinking about financial planning, physical prep, mental well-being.
Now is an excellent time to make a detailed baby budget with your partner if you haven't already.
What should that cover?
Discuss all the potential expenses: clothes, diapers, so many diapers, nursery furniture and gear, potential childcare costs down the line. Figure out where you can save or how you'll allocate funds. It reduces stress later.
Smart. Exercise.
Consider starting a pregnancy-safe workout routine if you haven't found one yet. The official recommendation is generally 20 to 30 minutes of moderate intensity exercise most days of the week.
What are the benefits?
Oh, numerous benefits. It helps build strength and endurance, which is great preparation for labor. It can improve your mood, reduce stress, help with sleep, just overall well-being.
Okay, hydration.
Crucial, keep focusing on hydration. Aim for about 10 8-ounce cups of water or other healthy beverages daily. A good rule of thumb, your urine should be pale yellow or colorless if you're well hydrated.
Easy check. Journaling.
Keeping a journal is still a powerful tool. Reflecting on your physical and emotional changes, improving mental clarity, plus creating a precious keepsake of this unique time.
And Kegels. People always mention Kegels.
Yes, don't forget your Kegels. Strengthening those pelvic floor muscles now can really help with easier post-birth healing, potentially prevent urinary incontinence later in life, and some say even improve sex after birth.
How do you do them?
You basically squeeze and lift the muscles you'd use to stop the flow of urine. Hold for a few seconds, release, repeat. The great thing is you can conveniently do them anytime, anywhere, nobody knows.
Multitasking.
Exactly. And finally, just to reinforce again, vaccinations. Flu shot, COVID-19 vaccine, safe, recommended, protect you, protect baby. Get them if you haven't.
Got it. Okay, so what does this all mean as we reach week 13? We're officially a third of the way through the pregnancy, and for many, those less pleasant first trimester symptoms are finally starting to fade. Your baby is now the size of a plum. This marks a major transition.
It really does. And this raises an important question. What exactly happens as you transition fully into the second trimester, and what changes can you anticipate? For many, this marks a significant and really welcome shift.
The honeymoon phase.
Often, yes. Those challenging early pregnancy symptoms like really tender breasts, extreme fatigue, strong food aversions, persistent morning sickness, and that constant need to pee. They often begin to notably subside around now.
A welcome relief.
Truly a welcome reprieve for many expecting parents. It allows you to start feeling more like your energetic self again. Your body is also already starting to prepare quite actively for breastfeeding.
Already? How?
Your breasts may have even begun producing tiny amounts of colostrum. That's the nutrient-rich, thick, yellowish fluid, sometimes called liquid gold, that will feed your baby for the first few days after birth before your mature milk comes in.
Wow, the body is always planning ahead. What about the baby's development at this plum-sized stage? What incredible new functions are coming online?
Your baby is now actively swallowing amniotic fluid, and excitingly, they're also excreting urine back into the fluid.
Wait, they're drinking it and peeing it out?
Essentially, yes.
Yeah.
They're recycling the amniotic fluid every few hours. This is a critical part of the maturation of their digestive and urinary systems. It sounds weird, but it's normal and necessary.
Okay. Recycling. Got it.
As they swallow, they also start producing meconium. That's the sticky, black, tar-like substance that will become your newborn's very first poop. It starts accumulating in their intestines now.
Preparing for the outside world already.
Absolutely. Their bones are continuing to harden and ossify, especially the long bones in the arms and legs and the skull, providing that crucial structural support. And remarkably, their unique fingerprints are starting to form on those tiny touchpads. A truly individual identifier taking shape.
Fingerprints. That's amazing. And what about symptoms this week, beyond the ones that are hopefully fading? What new experiences might arise as we enter this second trimester?
Well, occasional cramping is still common. Often it's just due to gas, bloating, or maybe round ligament pain.
Round ligament pain? What's that?
As your uterus grows, the ligaments that support it in your pelvis have to stretch, and sometimes that stretching causes sharp, brief pains, especially when you change position quickly. It's normal, but can be startling.
Okay. When should cramping be a concern?
If the cramping is severe, persistent, feels rhythmic like contractions, or is accompanied by other symptoms like fever, bleeding, unusual discharge, or dizziness, always call your doctor immediately to rule out anything serious.
Got it. What else might happen symptom-wise?
For many, appetite starts to return with a vengeance. And with that, distinct food cravings might truly emerge or intensify. You might also notice a stuffy nose.
A stuffy nose, like a cold.
Surprisingly common in pregnancy. It's often called pregnancy rhinitis. It's usually due to hormones and increased blood volume causing swelling in the mucous membranes in your nose. You can usually differentiate it from a cold because you won't have the other typical cold symptoms like sore throat or cough.
Interesting.
Those newly visible blue veins might become even more prominent as your blood volume continues its significant expansion. Vaginal discharge typically continues to be normal unless it changes color, small, or causes itching or pain. Those could signal an infection like yeast or BV, so get checked if that happens. And heartburn can unfortunately still be an issue for some due to both hormonal effects and increasing physical pressure on your stomach.
Okay, and the belly. Is it finally becoming more noticeably pregnant for most people now?
Yes. Often, week 13 is when things really start to shift visibly. With more energy returning and those early symptoms fading, you might start feeling more like your vibrant self again and looking visibly pregnant.
The bump emerges.
The uterus is now moving up and out of the pelvis, making that bump more noticeable, especially in fitted clothing. For many, this is a really exciting and affirming time, truly entering that honeymoon phase, where the discomfort often lessens and the joy and anticipation really take center stage.
Sounds like a nice phase. What should be on the comprehensive checklist for week 13 as you fully approach the second trimester, preparing for continued growth and new phases?
Okay, looking ahead, you can expect more frequent prenatal visits now. Typically, they transition to being scheduled monthly throughout the second trimester. This allows your provider to closely monitor your progress and the baby's development.
Monthly check-ins.
Yep. Also, continue to stock up on healthy pregnancy superfoods. Even if your appetite is roaring back, keep prioritizing lean protein, healthy fats, complex carbs, and those specific vitamins and minerals. It's crucial for sustaining your energy and supporting the baby's rapid growth spurt.
Fueling up.
Exactly. It's also a very good idea now to proactively learn about common pregnancy complications that can sometimes arise later, like gestational diabetes or preeclampsia.
Why learn about them now?
While your healthcare provider will diligently monitor you for signs, being aware of the potential warning signs yourself is empowering. It allows you to be an active participant in your own care and report any concerning symptoms promptly. Knowledge is power.
Good point. What about sleep position?
For optimal sleep and circulation, experts strongly recommend sleeping on your side, especially as you get further along in pregnancy. Left side is often touted as ideal, but either side is better than your back.
Why not sleep on your back?
Sleeping flat on your back can put pressure on major blood vessels, potentially reducing blood flow to your uterus and baby, and can also contribute to things like swelling, varicose veins, and hemorrhoids for you.
Okay, side sleeping it is. What if that's uncomfortable?
If side sleeping is a struggle, investing in a good pregnancy pillow, those big C-shaped or U-shaped ones, can make a huge difference in your comfort and support. Highly recommend.
Good tip. And sex during pregnancy.
Generally, sex during pregnancy is perfectly safe if you feel up to it and your doctor hasn't specifically advised against it due to certain complications. Many women actually experience an increased libido in the second trimester due to that increased blood flow to the pelvic area.
Oh, really?
Yes, and it absolutely won't harm the baby. They're well cushioned in there. Communication with your partner is key, of course.
Good to know. Lastly, maternity clothes. Any tips for saving money?
Yes. Since your body is changing so rapidly, think smart and economically. Explore secondhand options. Consignment shops or online marketplaces often have great deals. Consider clothing swaps with friends who have recently been pregnant. Or maybe borrow items. Comfort is key, but you don't necessarily need a whole new expensive wardrobe.
Smart shopping.
Definitely.
Wow. What an absolutely incredible, often unseen journey through this first trimester. It's really amazing to think about.
It truly is.
From that very moment of conception, often before you even realize you're pregnant, all the way to week 13, where your baby is plum-sized with all its vital organs in place.
Practicing swallowing, developing unique fingerprints.
Yeah.
It's just a period of truly monumental transformation.
Yeah, and we've seen how symptoms evolve from that early, intense fatigue and morning sickness
To hopefully the gradual return of energy and appetite as you approach the second trimester.
Right, and all the crucial preparations you can make for both your own body and your rapidly growing baby. It's really a testament to the sheer resilience and adaptive capacity of the human body.
Absolutely. And understanding these weekly changes really empowers you, doesn't it? Whether you're the one expecting or you're supporting a loved one, or maybe you're just curious about the process.
Yeah.
It helps you feel more informed, more connected, and honestly, just more awed by this profound experience. It highlights that intricate dance between maternal health and fetal development, laying that essential groundwork for the entire rest of the pregnancy journey.
It's not just about what's happening, but the incredible why behind it all.
Precisely.
So as we step into the second trimester, often called the honeymoon phase of pregnancy, where symptoms often subside and a new energy emerges, what new wonders and challenges do you anticipate as your body and baby continue their incredible interconnected transformation? What new connections will you feel with the life growing within?